Welcome to Part 2 of Chapter 11, the Endocrine System. We will continue to look at hormones, their function, and the glands that secrete the specific hormones. So you should be on page 144 of your PowerPoint packet. So here we are again at the same picture, but now we're going to focus on the regions in blue. Here we are at the posterior pituitary gland. The posterior pituitary gland is the back region of the pituitary gland whose job is to secrete two hormones, antidiuretic and oxytocin. We will look at both of those hormones in depth in the next few slides. So here is page 144 of the PowerPoint packet. Let's look at the table at all of the glands, the hormones, the target tissues, the function, and then the other. So again, we're going to start with the posterior pituitary gland. The posterior pituitary gland releases hormones that were produced in the hypothalamus. The first hormone we're going to discuss is oxytocin. Oxytocin is a hormone that's going to have two target tissues, the uterus and the mammary glands. The function of oxytocin is to cause the uterus to contract, leading to contractions during labor and delivery. The drug form of oxytocin is Pitocin. So if a woman is in labor, her body should be secreting plenty of oxytocin. Occasionally her labor gets stalled and they give her the drug form, which is Pitocin. Oxytocin is also involved in the production of milk. So after a woman has given birth and she has decided to nurse her baby, as prolactin, the primary milk hormone, is being produced, some of the oxytocin is also being released. Oxytocin will then cause uterine contractions after childbirth while the mother's nursing. This doesn't happen forever, but for the first few weeks as the mother nurses. This also causes the uterus to return to its normal size, which is why oxytocin has two target tissues, the uterus and the mammary glands. Our second hormone secreted by the posterior pituitary gland is antidiuretic, or ADH. So before we get into the details of this, let's think about the words. A diuretic is a medication that you could take, which is a water pill. A diuretic causes you to lose water. The name of this hormone is antidiuretic. So anti typically means opposed, opposite, or against. So if a diuretic causes you to lose water, antidiuretic is the hormone that's going to cause you to retain water in a good way. So what is the organ that's involved with production of water being released from your body? The kidneys. The majority of your urine is water. So the kidneys is the target tissue for antidiuretic. Antidiuretic stimulates the kidneys to retain water and reduce urine output. It is very important to only take diuretics or water pills if prescribed by your doctor. If you were to take a diuretic and you don't need it, you would lose too much water and could potentially end up in the hospital. So there is a condition called diabetes insipidus. Diabetes insipidus is different than diabetes mellitus, having to do with insulin. Diabetes insipidus results when your body doesn't make enough antidiuretic hormone. Therefore, your body does not retain enough water. Therefore, your kidneys become large factories of dilute urine making machines. So you would secrete too much water. Your symptoms would include dehydration, thirst, and fatigue. Your body needs water, and if you're losing too much, you would be very tired. The good news is, if you have diabetes insipidus, they can give you medication to fix this fairly easily. Continuing on, our thyroid gland is one of the largest and most important glands in the body. The thyroid gland is located on the trachea. It requires iodine to function. You get iodine in your diet by salt. Even if you don't salt your foods, if you eat any processed food, any canned food, any frozen food, it has salt added to it. You just need a little bit of iodine for this gland and hormone to function. What are the hormones the thyroid gland secretes? The primary hormone the thyroid gland secretes are T3 and T4. They are called T3 and T4 because of their fancy names, which are triiodothyronine and tetra, otherwise known as thyroxine. So the tri means 3, iodo meaning iodine. We are good with just knowing these as T3 and T4, or if you just know them as thyroid hormones. Thyroid hormones have an extremely important role in the body, which is why their target tissue is most cells of the body. Their role is to stimulate and increase metabolic rates. So if you were to have a slow metabolism, it is possible it is a thyroid gland issue. If you were to have a quick metabolism, again, it is possible it is an overactive thyroid gland. So let's see the difference. Over here, we're going to compare and contrast hypothyroidism and hyperthyroidism. Hypo, again, means below or under. So in hypothyroidism, your metabolism is slow, which would lead to weight gain. You would have a reduced appetite because your body is not processing the foods that you ate very quickly. So if you think about that, you're not eating very much, but you're gaining weight. You're also going to be tired. Your body is working very, very slowly. Your heart's beating slowly. Your muscles are contracting slowly. Your temperature and pulse would be low. And you could potentially have dry, cold skin because your blood is circulating more slowly. You may also get sick easily and take a long time to recuperate because your immune system is responding slowly. It is very common for women of menopause age to develop hypothyroidism. Unfortunately, most of the time, once you have hypothyroidism, you have it for the rest of your life. The good news is you can take medication to bring you back to homeostatic mechanisms. So now let's look at hyperthyroidism. Hyperthyroidism, now your metabolism is high, you are losing weight, you have an increase in appetite. So some of you may think that sounds like a good thing, like I can eat whatever I want, but I'm not going to gain any weight. However, think of how you feel when you're nervous before you give a test or to give a speech or take a test or something that's going to make you nervous. That's how your body is going to feel all the time. Your increase in heart rate has gone up, your pulse is up, you can't sleep because your mind is racing. It kind of feels like that adrenaline rush, but it doesn't go away. So you have an increase in metabolism, you have weight loss, increase in appetite, nervousness, increase in temperature and pulse, and warm flushed skin because your blood is circulating quickly. If you have hyperthyroidism, they will usually give you 6 to 8 weeks for your body to go back to normal. If after that point your body does not go back to normal, they often remove the thyroid. It is not possible to just take a medication to make this go slower. Thyroid cancer is not that uncommon. They will sometimes put radioactive isotopes in your thyroid to kill it, or they will remove your thyroid. It is important to understand that the thyroid gland is a huge important gland in your body, and not only does it secrete thyroid hormones, it also secretes something called calcitonin. Calcitonin looks like what it is. It is a hormone that's going to affect your bones, and this hormone has to do with calcium levels. So think calcitonin, calcium. This hormone was briefly discussed in Chapter 6, the skeletal system. Calcitonin's job is to be secreted when you have elevated calcium levels. So if you've just eaten a large meal with lots of calcium, ice cream, cheese, dairy, etc., calcitonin will be secreted to bring your levels back down. Calcitonin stimulates your bone to deposit more bone by increasing the rate of osteoblasts. Next on this page, we have the parathyroid gland. You actually have at least four parathyroid glands embedded in your thyroid gland. So if they were to remove your thyroid gland, they would also be taking out your parathyroid gland. This one's easy to remember. Your parathyroid gland secretes parathyroid hormone. The target tissue is bones and kidneys. Once again, the function of the bones and kidneys and parathyroid hormone is to regulate calcium levels. This hormone is the dominant calcium regulating hormone, meaning it's more in charge of calcium than calcitonin. It is actually going to work the opposite of calcitonin. Calcitonin was secreted when your blood calcium levels were high. This hormone is secreted when your blood calcium levels are low. So let's see what it says. When blood calcium is deficient, so you have low calcium in your blood, it stimulates osteoclasts. If you recall, osteoclast's job was to carve bone and inhibits osteoblasts. So now we're going to compare and contrast and see what is happening when you have high or low blood calcium. So in high blood calcium, you've just eaten a meal high in calcium, dairy, yogurt, ice cream, etc. You have too much calcium in your blood. The first thing your body wants to do is eliminate the extra calcium in your urine. You will also turn off osteoclasts because we don't need to carve any bone. We will increase the production of calcitonin, but we will decrease the production of parathyroid hormone. We call these hormones antagonistic because their amounts are opposite or in opposition of one another. When calcitonin is high, parathyroid hormone is low. In comparison, if you have low blood calcium levels, so you haven't eaten anything with calcium in several days, your body needs calcium for your muscles to contract, for your heart to beat. So your body is going to go looking for calcium. So if you have low calcium in your body, in your blood, you will secrete little to no calcium in your urine. Osteoclasts will be activated to start breaking down bone. We will decrease the amount of calcitonin, and we will increase the amount of parathyroid hormone. We will look at some pictures of these on the next few slides. So in this slide, we see, and we're going to discuss the hormone oxytocin. Oxytocin, if you recall, is a hormone secreted by the posterior pituitary gland. Oxytocin is going to have two target tissues. One is the mammary gland, and more importantly, is the uterus. Oxytocin's job is to cause the uterus to contract during childbirth. Antidiuretic. Antidiuretic hormone is also secreted by the posterior pituitary gland. This hormone acts upon the kidneys. This hormone causes your kidneys to retain water. Thyroid gland. Your thyroid gland is one of the largest glands in your body, located on the trachea. Embedded in the thyroid, you also see the parathyroid. If the thyroid gland is enlarged, you will perhaps get something called a goiter. A goiter is responsible for causing a disruption in thyroid hormones. If your thyroid gland is not secreting enough hormone, a child, which is actually fairly rare, could develop a condition called creatism. Hyperthyroidism can also cause nervous reactions and things like your eyes to bulge because of the muscles and the contraction of the blood vessels. The parathyroid hormone and gland are located in the thyroid gland. You have at least 4 parathyroid glands. The parathyroid hormone's job is to secrete parathyroid hormone and to regulate calcium levels. So now we are on page 145 of the PowerPoint packet. We are going to discuss the adrenal cortex and the adrenal medulla. Both of these glands sit on top of the kidneys. So you should have 2 kidneys and 2 adrenal glands. So what we would do is take the adrenal gland and we would cut it in half to see where these regions are located. The adrenal cortex is the outer region of the adrenal gland. It secretes something called glucocorticoids, whose job is to make something called cortisol. It also secretes something called androgen. These are not going to be discussed in detail, it's just a brief introduction. So glucocorticoids are going to affect most cells. Their job is to reduce inflammation. Think about cortisone shots if someone has, let's say, like pain in their knee or their back. That's basically a shot of cortisone or cortisol. Androgens also affect more cells. Androgens' jobs is to increase sex drive and what we call secondary sexual characteristics. Secondary sexual characteristics basically have to do with puberty and then moving forward into adulthood, which we will discuss on the reproductive hormone slide. The adrenal medulla is the inner portion of the adrenal gland. It secretes a hormone called epinephrine and sometimes called norepinephrine. This hormone used to be called adrenaline. This gland affects the heart, blood vessels, liver, and fat cells. It is released as part of the fight or flight response. So if you recall in the brain chapter, there are several divisions of the nervous system. We have the central nervous system and the peripheral nervous system. We then further divided the peripheral nervous system into sensory and motor. The motor was then divided into autonomic, which was automatic, and somatic. The autonomic was then divided further into sympathetic and parasympathetic. The sympathetic division of the nervous system controls something called the fight or flight response. The fight or flight response occurs during situations usually of danger or stress. Your heart rate goes up, the blood pressure goes up, your liver cells cause you to secrete more glucose so that you can use those glucose molecules to make more ATP along with your fat cells. The adrenal glands. You have, theoretically, 2 kidneys in your body. Sitting on top of each kidney is what is called the adrenal gland. Each adrenal gland is then divided into 2 regions, the adrenal cortex, which is the outer region, and the adrenal medulla, which is the inner region. Each of these regions or portions secretes different hormones. So one of the hormones secreted by the adrenal medulla is a very important hormone called epinephrine. It's sometimes called norepinephrine and they're linked together. We're going to use the word epinephrine. Epinephrine is the word that used to be called adrenaline. Epinephrine is a very important immune response, or nervous system response, rather. It is going to cause nervous system stimulation of the sympathetic division. So what that means is epinephrine during the fight or flight response is going to have many target tissues: your heart, your muscles, digestive system, etc. Epinephrine causes an increase in heart rate, breathing rate, blood pressure, etc. Epinephrine is typically only activated during times of stress. So now you should be on page 146 of the PowerPoint packet. This entire slide is discussing the pancreas. The pancreas is one of the most important glands, really an organ, in your body. The pancreas is located in your abdomen. Your pancreas is a vital organ. Without your pancreas, you cannot live. Unfortunately, if you have an unhealthy pancreas or you develop pancreatic cancer, the survival rates are not that great. So why is the pancreas so important? The pancreas secretes 2 very important hormones, insulin and glucagon. We're going to spend the majority of our time talking about insulin. So before we begin our discussion, let's kind of get a bearing of what we're talking about. So if you've eaten a meal, no matter what that meal is, but specifically a carbohydrate-rich meal, so pastas, grains, etc., the amount of glucose, which is a sugar, in your blood goes up. Your body then needs to have the glucose go from your blood into your cells. The glucose needs to go into your cells so that your cells can use the glucose by doing aerobic respiration to make ATP. If the glucose never gets into your cells, you will not make ATP and you will die. So it is crucial for that glucose to get into your cells. So what is the signal for the glucose to get into your cells? It is insulin. So you've just eaten a meal, your sugar levels go up, your pancreas then secretes insulin. Insulin tells your blood glucose levels to go down, meaning we're going to decrease them by secreting insulin and telling those glucose molecules to get into the cells. So what are the functions? Regulates the blood glucose concentration of glucose, secrete it and release to a rise or increase in glucose. Insulin promotes the uptake of glucose by your liver, muscle, and fat. So what happens is the extra glucose is going to go into your liver and be stored as something called glycogen. The extra glucose will go into your muscles and fat cells. If you continue to eat more glucose than what you need, you continue to get more fat cells, therefore you will gain weight. So before we begin our discussion on diabetes mellitus, let's talk about glucagon. Glucagon is also a hormone secreted by the pancreas. Its target organ is the liver. So now we haven't eaten in a while. We are hungry. Our cells need glucose. So glucagon is going to be released in relation to falling or a decrease in blood sugar levels. In the liver, glucagon stimulates the breakdown of glycogen. Glycogen is a polysaccharide, which are links or chains of glucose. So basically, it's a bunch of glucose molecules linked together. So your liver is going to release that extra glucose into your bloodstream, your blood glucose levels go up, and your body has maintained homeostasis. So let's see what happens when your insulin levels are not secreted at the right amounts. Then you possibly have a condition called diabetes mellitus. So what are your symptoms? Excess urine output. If you're eating lots of foods that have glucose in them, sugar, or even if you're just eating food and you're not secreting that glucose into your cells, then you have extra glucose in your blood. So one of the way your body is going to get rid of the excess is by extra urine output. Your urine might also smell fruity or sweet because it has too much sugar in it. Because you're urinating too much, that leads to intense thirst, hunger, and fatigue. Your cells must have glucose. If the glucose is staying in your blood, you are not making ATP and you're going to be very tired. Your cells will think if they're unable to make ATP that you must be hungry and tell you to eat more food, which causes the situation to get worse, more sugar in your blood. So what causes diabetes mellitus? Faulty insulin receptors. So basically the receptors, the lock and key, are not working on your cells and or your pancreas. Or you're making insulin but not enough. So type 1, which used to be called juvenile diabetes, is something called insulin dependent. So if you have type 1 diabetes, you would need to check your blood sugar levels throughout the day, and then potentially, whether you have a pump or you have injections, you would inject insulin at the proper amounts. Type 2 diabetes typically is going to be an onset as you get older. Age, heredity, meaning your genetics, obesity, lack of a good diet, lack of exercise are several risk factors for type 2. Type 2 can be treated with medication and lifestyle changes. However, if type 2 turns into type 1, in other words, if type 2 goes unmonitored or uncontrolled, once you've reached type 1, you cannot go back to type 2. So it's very important to maintain a healthy lifestyle and keep your pancreas healthy. The pancreas. The pancreas is an organ located in the abdomen of your body. The pancreas is one of the most important organs in your body. The pancreas is not essentially a gland, it is an organ. It secretes two very important hormones, insulin and glucagon. Insulin is the very important hormone whose job is to regulate your blood sugar levels. So here we can see in the picture, we are in your blood, and it says absorption of blood and sugar. What needs to happen after you've eaten is the glucose in your blood, glucose is the sugar, which is created by the breaking of your food, needs to go into your cells, specifically your liver cells. It really needs to go into all of your cells. So the reason why the glucose needs to go into your cells is because the cells use the glucose to make ATP during metabolism. This will be discussed in Unit 5. So let's review. You've eaten a meal. The amount of blood and sugar go up. So in other words, the amount of blood sugar go up. The amount of glucose in your blood increases. We want homeostatic mechanisms to do their job. So you've just eaten a meal. Blood glucose goes up. Insulin is secreted, which is the hormone, to those amounts of glucose in your blood. The insulin will tell the glucose to move into your cells. Once the glucose is into your cells, it will be used to make ATP. On the inverse of that, glucagon is a hormone that is secreted when your blood sugar levels are low. So now we're going to take what is called glycogen, which is the stored glucose. We're going to break it down into individual glucose molecules and put it back into your bloodstream to increase your blood sugar levels. If insulin is not secreted properly, the receptors don't work. That leads to a condition called diabetes. This figure is similar to the figure we looked at with calcium. So here we have homeostasis, we're going to start here. We have our set point. So now our blood sugar levels go up. We've just eaten a meal. What should happen is insulin should be secreted or released. Insulin then tells the sugar, the glucose, to go into your muscles, into your liver to be stored. Excess glucose is also stored as fat. Let's go back to the beginning. So now you have low glucose, so you haven't eaten in a while. So now your blood sugar levels are low. Now you're going to secrete something called glucagon. Glucagon is going to tell your liver and your muscles to get rid of or release the extra stored glucose, and now your glucose levels are maintained in your blood. You should now be on page 147 of the PowerPoint packet. This is the last set of hormones and glands, their target tissues and functions. So let's begin with our discussion of the ovaries. So we've discussed the ovaries and testes briefly in relation to the hypothalamic releasing hormones and the anterior pituitary gland. The ovaries are a structure located in the female reproductive tract. Females are born with two hopefully functioning ovaries. The ovaries' job is to secrete a variety of hormones, including estrogen and progesterone. These hormones are secreted by the ovaries and affect most of the cells of the body. The ovaries play a role in the menstrual cycle, including ovulation. The ovaries also help prepare for pregnancy and developing embryos. LH and FSH, which we've described on previous slides, are going to control the production of estrogen, testosterone, progesterone, etc. from the male and female reproductive hormones. The testes are the primary male hormone is going to be testosterone. It also affects most cells of the body. Testosterone's job is to sustain sperm production and sex drive. It stimulates the development of male reproductive system. Both of these are also going to be involved in puberty. The pineal gland is a small gland located in the brain. Its job is to secrete a hormone called melatonin. Melatonin's target tissue is the hypothalamus. The melatonin is a hormone that plays a role in sleep, daily cycles called circadian rhythms, and the onset of puberty. Light also affects its function. Melatonin is a hormone sometimes given to elderly patients in nursing homes to help their sleep-wake cycles get back on track. The last hormone and gland are the thymus gland and the thymosin hormone. The thymus gland is a hormone located on your sternum that actually gets smaller with age. The thymus gland secretes a hormone called thymosin. This hormone's target tissue is the immune system cells. If you've ever heard of a T cell, the T comes from thymus. It is the site of maturation of white blood cells, which we will discuss in Chapter 14, the lymphatic system. They are called T cells, and they play a critical role in the immune system, which we will discuss later. Melatonin. Melatonin is a hormone secreted by the pineal gland. The pineal gland is located in your brain. Melatonin is going to have to do with your sleep-wake cycle. We sometimes call these circadian rhythms. Circadian rhythms are basically your biorhythms throughout the day, your sleep-wake pattern, your increase in heart rate or blood pressure throughout the day. Melatonin, which is kind of a weird picture because the eyeball is just kind of hanging out there. Melatonin is going to be influenced by light, which is one reason why here in the Midwest, the winter months, we tend to be more sleepy because we have energetic when we have more light. Thymosin. So thymosin is a hormone secreted by the thymus gland. Your thymus gland is a very large gland when you are younger, up until about puberty. Thymus gland's job is to secrete or store what are called T cells, T for thymus. These T cells are part of your immune system. As we get older, specifically puberty and on, this gland shrinks to almost nothing. They produce the types of cells that we need for our immune system. Regulation of hormones. So now we are back in the PowerPoint packet on the last few slides. So we have discussed lots of hormones. Now we need to figure out how hormones are actually regulated. In other words, how does your body know when to secrete or not to secrete these hormones? Blood levels of chemicals. So can you think of any hormone whose job it was to secrete or tell your body to secrete based on the amount in your blood? Good. Insulin. Insulin had to do with blood glucose. Parathyroid and calcitonin had to do with blood levels of calcium. Other hormones. In other words, one hormone tells the body to secrete another hormone. So examples include TSH, which is thyroid stimulating hormone, which stimulates the thyroid gland. FSH, which stimulates your follicles. LH, which has to do with ovulation and sperm or testosterone production. The nervous system. So there was one hormone in particular whose job it was to act on the nervous system. It increased heart rate, breathing rate. It was the fight-or-flight response. Epinephrine. Negative feedback. So if you recall, negative feedback is a mechanism to actually get you back on track. So several hormones, such as testosterone, tells your body when you've secreted enough and to stop secreting because you don't want to produce something you already have. Before we leave, let's go through the study questions. Question 1. Which of the following is a function of the endocrine system? Controls homeostasis, helps the immune system, monitors blood glucose, maintains water balance, or all of the above? E, all of the above. Question 2, prolactin. So again, look at the words, look at the letters in the word. So prolactin looks like lactose or lactate. Is it involved in blood glucose? Involved in uterine contractions, milk production, or regulating metabolism? C, milk production. Insulin, involved in blood glucose, involved in uterine contractions, milk production, or regulates metabolism? A, blood glucose. The pancreas secretes estrogen, involved in diabetes insipidus, located in the pelvic cavity, secretes glucagon. D, secretes glucagon. Diabetes insipidus was ADH. Diabetes mellitus is pancreas. Last study question. Patrick was diagnosed with diabetes mellitus on his 8th birthday. His 65-year-old aunt was diagnosed with diabetes also. Patrick is having a hard time understanding why he needs injections, while his aunt controls her blood sugar with diet and oral medication. Why is his aunt's treatment different than his? Patrick has type 1 diabetes versus his aunt who has type 2 diabetes. Type 2 diabetes can often be